Hi, my name is Dr. Lee Norman, and I'm the Secretary of the Kansas Department of Health and Environment. Today, we're having a conversation about COVID-19, especially how it affects the rural parts of our state. I'm joined today by two very dynamic women, Dr. Jennifer Bacani McKenney and Destany Wheeler. Dr. Bacani McKenney owns and practices in the Bacani McKenney Clinic in Fredonia, Kansas. She is also the county health officer. Destany Wheeler is the director of the Wilson County Health Department. They are also kind enough to send me this amazing shirt. I'll pause a minute so you can read it. Yes. And they have one each also that's different than my own. So thank you guys for coming onto this broadcast. It's great to see you. I want to ask you some questions, if I may. I want each of you, and Jennifer, we'll start with you. Can each of you tell me about you, the role you play in your community? How long have you been in your current position?
Sure. And thank you for having us, Dr. Norman. We're super excited to be here. And my shirt at this time says, "Spread love, not viruses." And I have been in Fredonia practicing as a family physician for the last 10 years. This is actually my hometown, so I practice in the hospital where I was born, and I work with my dad and two other partners there. So I have loved being a family physician here. Other roles that I play in the community, I happen to be the school board president. I also am a business owner of our clinic, of course. And then I also am on the boards of a group called Cultivate Fredonia and our community foundation. And I bring that up because as many people know, in rural communities, we wear many hats. And so that oftentimes will help us in our networking and communication with people.
Wow, you do it all. Are you also a minister of the gospel and chili stand operator on the side or anything like that? But
Not yet, but I have it pulled up on the internet to get certified right after this.
Thank you. Destany, tell me a little about yourself.
Yeah. I am the health department administrator. I've actually been with the health department since 2009. So right in the middle of the H1N1 pandemic was when I stepped into public health. And I've been the administrator it was 2 years on Valentine's Day. So just over 2 years. And like Jen said, we wear so many hats in our community. I don't wear quite as many as her, but I do the group that she mentioned, Cultivate Fredonia. I'm the chair of one of their teams, the Healthy Living Action Team, and we do a lot of fun community wellness and physical activity stuff around Fredonia.
Oh, great. Well, you've gotten some experience under your belt with other pandemics, and I guess you've become a specialist at it now.
Oh, I'm not going to.
Whether you want to or not.
He's a pandemicologist, I'm pretty sure. I think that's what they call it.
Dr. McKenney, how has COVID-19 changed your practice?
I am doing things that I never thought I would be doing. Now, I say that in that it's been a very positive thing in many ways, and it's also been a challenging role for us to play because we still want to take care of our patients, and we know that our patient numbers are down right now because we want people to stay home and stay safe. But we started doing telehealth visits, we started doing phone visits, we do curbside visits and parking lot visits. I've done a lot of weird things in parking lots in my life, but now I'm adding to that list. So, doing like injections or taking urine samples from the parking lot. We're doing everything that we need to do to make sure that our patients are safe. We're not putting them at any risk, but that we're still taking care of their chronic care needs like diabetes and high blood pressure, and well visits as well. And we still know that there are other things like allergies and sinus infections and everything else going on that we need to treat at the same time. So we've gotten very creative. This is probably stuff that will continue on even after the pandemic, because we know that there are ways to reach our patients now that might actually be more convenient for them too. So we're going to keep trying to be creative and innovative and do whatever our patients need.
Well, yeah. So the new normal may not be what our old normal was like. Sounds like what you're saying. Destany, how has COVID-19 impacted your health department? Can you tell us a little bit about your department staff, adequacy of the numbers of staff, et cetera? Because this has obviously been an increased workload.
Absolutely. Yeah. Yeah. We have a full-time staff of 4. So we have a nurse, we have a public information officer, we have an office manager and myself full-time, and then I have a part-time nurse, part-time receptionist, and we share a dietitian for WIC with 5 other counties. So it has definitely stretched us. But as many other counties in rural Kansas, we all wear many, many hats anyhow. So, I mean, I just have to say my staff has been amazing. They see a challenge, they face it. We're doing WIC remotely. Our front doors are closed, but we are doing immunizations by appointments. We're doing all those normal day-to-day things, just with a twist, like Jennifer said. My office manager is also the sanitarian, so she's still going out and doing all those lagoon inspections and everything on top of everything else. They've really been amazing.
The biggest takeaway so far, realizing we're probably overall pretty early in this, Destiny, what do you think is the biggest takeaway so far from what and how you've had to adjust at this point? And Jen, I'm going to ask you the same thing as well. But Destiny.
Yeah. So for us, the biggest takeaway, I mean, really, for the health department is those relationships that we have built before this all started are the absolute key to managing it. We have had such good response from our faith leaders, from our hospitals, from our just the physicians themselves, the mayors and city managers of all the little communities that are in Wilson County. They have been amazing. They are as accessible as we are, and that is pretty accessible right now. So they are really, really all working with us and supporting us and just doing really great things. I do have to shout out to my regional partners too. My preparedness region is we're in the lower 8, which is the lower 8 counties in the southeast quarter, and all of the ladies in Lee in the lower 8, we have a group text message group, and we are on it all the time, asking questions. And so I would say those relationships that we've already built and fostered have been the key.
So the relationships and then the communication it leads to. What about
Absolutely.
you, Jennifer?
I would say one of our biggest takeaways is really that we've seen the best come out in people. We know that at these times, people are also scared and they're stressed and they're looking for hope. And sometimes that looks like kind of scary things that come out because of it. But for the most part, we've been seeing that people are really so giving and generous. And we can only speak to Wilson County, but we've seen it throughout all of Kansas, really. But people are making masks and putting them in our blessing boxes so people can get masks for free. They can get food for free when they stop in there. We've delivered tens of thousands of meals to people in their homes. We've seen people just, deliver groceries to each other, check on their neighbors, just things that we hadn't seen in the past because I think, we were all busy doing everything that we were supposed to be doing before. And now we are in the stay home order. We know that people need to be taken care of, checked on. And so just seeing that develop, just the kindness of humanity has been amazing. And like Destiny said, we've been communicating. We started having meetings for the county the Monday after COVID came to Kansas. So that day we had schools and governments and businesses and churches and everybody, the hospitals, the clinics, and we just started meeting every week. And we just said, let's just keep each other educated. Let's keep each other on top of things. So we met for weeks before we ever had a case in Wilson County. Mm-hmm. But I think that kind of thing, teaching us about the importance of communication, being able to educate people, I think that's made it so much better for us to be able to continue to spread the word and build that trust when we know that we have more to come.
Yeah, that's great. So the final question I have for you guys is about, you live in rural America. I grew up in rural America, but I've become kind of urbanized my last 30 or 40 years, I think. But how would you characterize the difference between rural America and urban when it comes to COVID-19 and the things you have to think about? Jen, why don't you go ahead first?
Okay. It's harder on Zoom. Is it you? Is it me? All right. So I think in rural America, one thing you find out is most people are related. So you always know who has been hanging out with who and who's doing what. So contact tracing gets a little bit easier. Destiny can speak to that because we just know what everybody's doing. But at the same time, we also know who we need to watch out for, who's having a harder time at home and who needs a meal brought to them. So I just think that we're able to be so intimately connected in such a challenging time as this that it gives us strength in those relationships we've talked about, in that knowledge of people, not just on the surface, like you're my patient or you come to WIC each week, but it's, hey, I see you at the grocery store. Hey, my kid's in your same class, in elementary school. And we're able to reach out in ways and understand people in ways that we might not in an urban area where there are so many other people.
So more familiarity with each other. What about you, Destiny?
Yeah, I would echo that. I think, the level of familiarity with our patients. I mean, I don't know if you know this, but Jen and I actually graduated from high school together here in Fredonia. So obviously there's some familiarity there. But yeah, you're very, there's no anonymity when you live in a town this size. If you call, I know this because it happened to my nurse, if you call Sonic to place an order, they ask you questions about COVID. If you go to the grocery store, if you go to the hardware store, wherever I go from walking down the street, there are so many questions. And I think it's great that we can have that kind of personal connection with so many people in our county and really get to the root of what they're afraid of and what they need to know to reassure them and what they may not understand. That there's a lot of data going around that makes things look a little less scary, and we don't want people to relax too much, but we don't want them to be scared. And I think that we can keep a pretty good feel on the pulse of the community since it is so much smaller.
So closeness.
Yes.
I will say also, if it's okay, that our healthcare our healthcare workers supply, I guess, maybe, I don't know if that's the best way to say it, but like I mentioned, I work with my dad, and almost half of our providers in Wilson County are over age 70. And so we want to protect them. If one of us gets sick in our hospital or in the county, that's a big percentage of all of our healthcare providers. Or if we have one positive case and we didn't know that they had it and people were exposed, worrying about knocking out a lot of the healthcare staff, like the nursing staff and even our, front office people. So we do have other challenges that we have to meet, and we really have to be extra careful because just one person out of the workforce can make a big difference for us.
Well, that's great. I think it gives us all a pretty good feel for the world you're living in right now. I'm done with my questions.
Oh, does that mean we have questions for you, Dr. Norman?
If you must.
Destiny, did you show your shirt already to everybody?
Yeah, I did.
Okay, yeah. No, Destiny too. Okay, I just want to make sure we're
I'll
kind of proud of
smooth it
our
out.
shirt. Oh, look at that thing. That's so good. Thanks for wearing it. We know that you have, you've been a great leader for us, and we'll just throw it out there. Thank you for everything you've done. What would you say has been your best day through this, which I know is kind of a weird question because it's a pandemic, but what's been your best day and what's been your worst day?
Ooh. There's the worst day, there's many to choose from, and the best day, there's very few to choose from. It has been such... I think you maybe know this. I was deployed with the Army to the Middle East in 2017 and 2018. And this feels so much to me like Army deployment, which is you just immerse in it, and it's 7 days a week, 24 hours a day, 7 days a week, 365 days a year. The best day, I think, would be when we first stood up Incident Command. We got the group all together and said, we don't know where this is going to go, but it was a little bit to your point, Destiny. It was like getting the band back together again. It's people I knew from 2009 with H1N1, 2014 with Ebola preparedness, and that's when the work really started. But when the team gelled together and we had all the pieces in place, and I said we're going to be fine. but it's going to be a lot of work. I think the worst day probably, and of course it's always on weekends when things get the busiest for whatever reason, was when it became very apparent that the packing plants in the state of Kansas were going to be tinderboxes for more and more and more yet COVID-19 cases. And it was just one of those sinking spells of, I know where this is going. And that's what's happened. I think we've got a pretty good handle on it, but it's just such a huge situation, huge difficult. And that was on a Sunday, of course, and it was just kind of weighs on one's mind.
Thank you.
Yeah, I'm going to jump in here and ask one really quick. And you kind of alluded to it just a second ago. There's been a lot of talk about the peak and when the peak is or when it will be, and that we should be nearing the peak, but we do see the cases going up and up. Can you explain that a little bit? How we could be either at or reaching the peak with the cases going up so much?
Yeah, it's a great question, and it's kind of not intuitive. I think we've actually right at our peak now. I think we'll look 2 weeks from now and look back and say, yeah, it was the third week of April, toward the end of April, when we really peaked out. I'm basing that on not on the total number of cases. If we wanted to have peaked out on the cases, what we would do is we'd quit testing people, because then the cases would drop like a rock. But, you know, when you look at our own website, for example, the influenza-like illnesses throughout the state of Kansas, which is influenza, which is going away, of course, seasonally, but also it's COVID-19 is an influenza-like illness that is being scored like that. It is dropping like a rock in terms of the number of cases presenting. So that's number one. Second is the hospitalization rate, and hospitalization per capita is dropping. The number of patients in the hospital with it is dropping. The number of deaths are dropping. So on the one hand, we're doing more and more testing, and it's going to just continue to climb up as long as we do more testing. But the other indicators that are very objective indicators, if there are people out there now that we didn't test for COVID-19 and they got worse, they'd be in the hospital or they'd be dying. And we are still having more hospitalizations and more deaths, but the rate of those is dropping. So I think we're actually at the peak now, maybe or even a little past it.
All right. I think one of the hot topics right now is the stay home mandate expiring and the state or the counties reopening. Can you comment on how you feel like that will look, or anything that makes you nervous or anything that makes you excited about it?
Yeah, it is exciting time in the sense that, one, it's a difficult decision as to actually what to do. And the governor and I and her team and mine have been working this, because it's the public health indicators that are ones driving it, the decisions that are being made. Kansas is a complicated state in the sense that there's 105 counties, yes, but everything from very urban to very frontier. And to think that you can homogenize that and have one size fits all for all 105 counties is a crazy idea. I like the way the governor's given, and we'll get more information this week, but I think it's very safe to say that when the executive order expires, the considerable amount of autonomy will be able to be exercised county by county, because what fits in Thomas County doesn't necessarily fit in Wyandotte County or Wilson County. So I think it gives people an opportunity to have control over their own destiny.
Good one.
Two different spellings, but I won't hold that against you.
Well, thank you. I appreciate that. So I have a question about public health, because as we know, there nationwide is a lot of focus on treatment and not nearly as much focus on prevention. And this is just pretty much the trend nationwide. And we've really seen public health really kind of come to the forefront during this pandemic. Do you think, this is your opinion I'm asking for, do you think that this will change after the pandemic, that maybe there'll be a little bit more integration and cooperation between what public health is doing and what normal healthcare is?
I think so. I think at many levels, actually, I think there's going to be things change. And it's just ironic. I gave a talk to the legislators, the leaders anyway. I called it the Health of Kansans 2020. And I talked about how public health has been underfunded chronically. So, and it's one of the curses of public health is that if you do a great job, then things don't happen. So how do you diagnose when things don't happen? And it takes something like this to really have an awakening. And I think there'll be a major awakening. We have focused much more on response than we have on the preparedness side. And I think there's going to be a lot more efforts and resources ideally put upstream on the preparedness side. And Kansas way underfunds public health. In the state of Kansas, out of general funds at $60 per Kansan per year is what the investment is out of state funds for public health. And as I've said all along this, people spend an average of $90 a day on Super Bowl Sunday on food and beverage and merch. So we need to do better on the funding side. But I think also it's about the training pipeline and how you continue to fund education and the things that then roll up into, because public health is so broad. And I think that we will see more love. And I hope it stays for a very long time. I've been preaching this for decades, and even before I was in this role. And the chickens have come home to roost. The response has been spotty, and it shows the weaknesses that we've underinvested in.
And I just want to explain the reason I made that silly face was because Jennifer and we say that all the time, is if public health worked, nothing happens. So we were
it's
right.
Good. We're glad we taught you that, Secretary Norman. Just kidding. Well, you bring up chickens. This is our last question for you. Very important on the minds of every Kansan. Do you prefer original recipe or spicy, Dr. Norman?
I look like an old guy, but it's gotta be spicy. Spicy all the way.
We would expect nothing less from.
And I'm an Army colonel, don't you?
Yeah.
It's very fitting.
Well, we want to say thank you so much for what you're doing, what Governor Kelly's doing, what the entire KDHE staff is doing. We look to you guys for leadership. We are always listening when you give us guidance. And so we appreciate everything that you're doing at this time. And please keep fighting the good fight and fighting for us Kansans, because we see you doing it and we've got your back.
Well, thanks. You guys are not only the boots on the ground, but you're the leaders out there as well. We recognize that, and thank you guys so much for what you're doing. Okay, so this is Lee Norman signing off with these two remarkable women from Wilson County. Thank you guys so much for being here.